Good morning to all. Today I am discussing clinical laboratory test prepared by Dency Veena, Assistant Professor, Emmanuel Arasar College of Pharmacy. Part 1. Clinical laboratory tests. The laboratory is a very important part of medical diagnosis. It provides accurate and objective information that supports the doctor's findings from patient history and physical examination. Clinical laboratory tests have greatly improved the diagnostics process. Today, disease can be identified earlier and more accurately than before. Blood and urine are the most commonly used body fluids for laboratory analysis because they give reliable information about the patient's health. Importance of clinical laboratory test helps in understanding the patient and disease condition and enables pharmacists to provide better pharmaceutical care and drug information, assist in diagnosis of disease and detects abnormal constants for abnormal physiological values, supports diagnosis along with signs and symptoms and aids in therapeutic management decision, helps in selection and adjustment of drug therapy and useful in monitoring drug therapy and treatment response. First one, hematological. Hematology is the science of study of blood and blood disease. Hematological tests can be diagnosis anemia, infection, hemophilia, blood clotting disorders and leukemia. First one, blood. Blood is specialized fluid connective tissue that consists of plasma, corpuscles, WBC, RBC and platelets. It circulates throughout the body. Functions of blood. Functions of blood in the body such as transportation of vital elements such as nutrients, oxygen and hormones etc. to cells. Functions of blood in the body such as transport of vital elements such as nutrients, oxygen and hormones etc. to cells, tissues and organs. Elimination of waste from cells and the tissues or organs. Regulation of body temperature and the thermoregulations. Then blood composition. Blood composition. Blood is made up of several different types of blood cells suspended in clear, straw colored fluid called plasma. Cellular substances in the blood cells 45%, then 44% RBC and 1% buffet. Coat containing platelets and WBC. Plasma 55%, total 91% liquid and solid 91% liquid and solid 9%. Normal range of platelets in the 0.15 to 0.4 million. WBC are divided into two types: granulocytes, neutrophils, eosinophils, basophils. Actinocytes and the lymphocytes, normal value 20 to 40%, monocytes 0 to 10%. Types of blood cells: red blood cells, platelets, white blood cells. For example, erythroid blood RBC. For example, RBC helps in oxygen and carbon dioxide exchange. Platelet and the rhombocytes help in blood clotting. White blood cells is called leukocytes. Then against infections of cells, neutrophil, eosinophil, basophil, lymphocytes and monocytes. Then types: white blood cells in the granulocytes, neutrophil, eosinophil, basophil, and granulocytes in the lymphocytes and monocytes. Neutrophils help in phagocytosis, eosinophils and the fights against paralytic infection, basophil and the produce inflammatory and allergic reactions. Lymphocytes means produces specific immune responses. Monocytes and the fights of bacteria, virus and fungi. Then erythrocytes. Red blood cells, erythrocytes sufficient level or red blood cells are the most abundant blood cells in the human body. General features: they do not contain intracellular organelles but contain a respiratory pigment called hemoglobin. Lifespan and 120 days. Measurement for the RBC count, the hemoglobin count is the most common pathological test employed for clinical purposes. Hemoglobin, a protein in red blood cells, transports oxygen to tissues and maintains a hemoglobin content in whole blood is measured in grams per deciliter. Physiological functions: RBC transport oxygen from the lungs to tissues where it serves an electron sources and ATP synthesis source in the mitochondria. Normal range RBC count for men 4.35 to 5.65 million RBC per ml of blood. Women's 3.92 to 5.13 million RBC per ml of blood. Hemoglobin count: males 4 to 18 gram, females 12 to 16 gram. White blood cells. White blood cells, these help fight infections and aid in the immune process. Types of white blood cells include the following: lymphocytes and monocytes, eosinophil, basophil, neutrophils. Lymphocyte is a type of leukocytes that is a granular and have larger nucleus than monocytes. Functions: lymphocytes play a role in acquired immunity to foreign cells and antigens. They are responsible for immunological reactions invading transplanted organs and foreign proteins. Normal range in adult: 1000 and 4800 lymphocytes in every 1 ml of blood. And then monocytes. Monocytes are a type of white blood cells, leukocytes that reside in the blood and tissues to find and destroy germs. Example: virus, bacteria, fungi, and protozoa, and eliminate infected cells. Function: monocytes are cells free fighters. Their lifestyle begins in the bone marrow, where they grow and try to protect your body. Monocyte count is between 2% and 10% of your white blood cells count. This equals about 200 to 800 monocytes per microliter of blood in the healthy adult. And then eosinophils. Eosinophils are a type of white blood cells that protect body from parasites, allergens, foreign bacteria, and outside organisms. Eosinophils are larger than most cells and make up less than 5% of all white blood cells in our body. Functions: eosinophils help your body defend itself from infection by parasites, exposure to allergens, immediate hypersensitivity reactions. Basophils are a type of white blood cell. Although they produce in the bone marrow, there is only very flow of your body. Normal range: basophils account for less than 3% of your white blood cells. You should have 0 to 300 basophils per microliter of blood. Neutrophils are a type of white blood cells, cells that access your immune system, first line of defense. Then platelets, also known as thrombocytes, are small disc-shaped non-nucleated bodies formed by the cytoplasm of megakaryocytes in red bone marrow. They contain variety of substances that are important for blood clotting. General features of platelets: 2 to 4 mm diameter, lifespan 8 to 11 days. Macrophages. Physiological functions: platelets help in the process of blood coagulation and thus help in maintaining hemostasis. Hemostasis: it is a body natural response to an injury which stops bleeding and fixes the damage. Usually this ability helps in preserving blood, avoiding infections. Common hematological test for blood: complete blood count, complete interest in the white blood cells, red blood cells, platelet count, hematocrit, red blood cell volume, hemoglobin concentration, differential white blood count, red blood cells indices. Interpretations of clinical laboratory test of complete blood count: constant hemoglobin, males 4 to 80 gram, female 12 to 60 gram, variation above upper limit range below low range interpretation of the condition known as polycythemia. Condition is referred of anemia, hemoglobin. Hemotrix nails on the increase on more fluid cancer, there is increase in erythropoietin. Decrease on in anemia, hemorrhage or hemolysis. RBC increase on macrocytic anemia, decrease on microcytic anemia. Leukocyte increase on leukocyte leukemia, increase on neutrophils, increase on degree increase on bacterial infection, Hydrophilia with asthma, parasitic infections, skin infections. Eosinophils means in patient with asthma, parasitic infection, skin infection, acute inflammatory conditions and in acute stress. Basophils increase an allergic reaction, hypothyroidism, anemia, decrease an chronic corticosteroids, hypertension. Lymphocytes increase an tuberculosis mumps. Decrease on lymphopenia, congestive heart failure, platelets increase on thrombocytosis. Thank you.